Well, chemo and radiation. We also offer other types of therapies like hormonal therapies, which are very useful for certain types of cancer, and other therapies that support chemo and radiation. For example, chemo oftentimes causes white blood cell counts and red blood cell counts to drop, so we would provide transfusions. And we might provide medications such as enoxaparin, GM-CSF, other medications that will cause the body to raise up the red blood cell count and the white blood cell counts. Well, many chemotherapies will affect blood-forming elements, and so the result is anemia. Anybody who has ever experienced anemia can rattle off the symptoms easily enough. It's mostly fatigue and lightheadedness. Not always lightheadedness if it's happened slowly over a period of time, but incredible weakness. Giving somebody a blood transfusion restores energy and vitality. So unfortunately, it's not permanent. They're time limited in how long they're effective, because we're always replacing our blood-forming elements, but we can provide ongoing transfusions. I'm asked frequently, why would we do that? You know, when you're dealing with a patient population with such a limited life expectancy, why not just relieve their symptoms? But there are several reasons, I think, to do that and to offer that to our patients. Number one is our philosophy here at Chapters is that people shouldn't really have to make a choice between receiving hospice benefits and receiving the care for their medical condition. Sometimes the best way to control symptoms are to control the underlying disease. A couple of examples of that might be somebody who has maybe a mass pressing on the esophagus so they can't swallow. We could control the pain, but if we could give chemo or radiation and shrink that so that they could again have the sensation of eating and drinking, and yet be awake and able to interact with their families, we've done them a huge favor. We typically review people who are on chemotherapy on a monthly basis to be certain that it is still beneficial. If it ceases to be beneficial, then we have a conversation and we say, listen, we think you will actually have a better quality of life without this going forward.